considering if someone else has tried what we're going to try, whether it's worked or not? You know, we teach our kids about data and about looking at it, about facts, about pulling together that information that's out there to write a paper or a thesis. Shouldn't we be looking at the same things that are out there? And then we have the U.S. Surgeon General. And while he was talking about UNC, North Carolina, going from in-person to virtual, what did he say? He said the best reopening plan in the world can fail in the face of high background community spread. In other words, where the virus is really aggressive, we can have the best plans, and it still won't work because of where the virus is. And we can change that over time by what we do, but where the virus is today in our state and in our communities, we can't change by just wishing it away or rationalizing it away, which is a lot of what we see. The fact is that I'm the dad of 2 school-age kids, and I'm also governor. My recommendation is about what I see in public health and what I believe is the very best thing to protect our kids. And no matter how much pressure is put on us or what type of theater is created to try to turn this thing political, it is all about the safety of my and your kids. And that's what it's always going to be with me. That's really important. The best plans don't work if there is an aggressive community spread. As of today, with only a couple of individual schools now reopened, we know that one has already had to move to virtual based on a COVID positive kiddo that we hope gets better. And we now have one superintendent that's tested positive. Again, I'm sure worked on the best plans that he could. I'm sure is trying to follow health advice the best he could. But this thing is so aggressive that it can still happen to people like me. And while I have tested negative, this thing is so hot right now, we have to understand our limitations and have humility in how we address this virus if we're going to protect those around us. So with that, I'll ask Dr. Stack to come up.
Thank you, Governor. So following up on where he left off just now, it's clear that it's been said at the national level about the importance of bringing kids back to school, and we've said it here. This is really not an issue where public health is in any disagreement with education. In fact, public health spends a lot of its efforts trying to help children avoid adverse childhood events that set them up for a difficult life ahead, trying to take steps to ensure they have healthy and nurturing childhoods, trying to minimize and avoid substance use disorders from developing and the consequences that happen, and ensuring that children get vaccinations and improving their health and wellness throughout their childhood and keeping them safe from preventable illness and disease, and countless other things we do. We worry about things that happen to kids in the public health domain that we want to try to prevent. So it's not easily that we recommend that students defer their arrival to in-person class. And this is an area where, even though at the national level there's clearly an emphasis on getting back to school, the Surgeon General himself has said when your test positivity rate goes over 10%, it's going to be really hard to succeed because the disease just spreads too fast. That even with the right plans in place and the best things you can do, there's just too much disease around and your measures won't likely be successful. The federal government in the United States is a little more generous in that. They say over 10%. The World Health Organization says if you're over 5%, that you're going to have a really hard time succeeding. And we've seen that. The University of North Carolina, Chapel Hill, on the collegiate level, shut down within 2 weeks because the disease was spreading too quickly. I have the privilege to work with these professionals in the public health domain, and I spoke with the Surgeon General while the Governor was starting this press conference right now. He's tweeted and been on record saying the things that I just said, and he affirmed them when I just talked to him now. We're all committed to getting kids back to school. It's important. But we've got to do it safely, and I still have the concern that despite all the time we've spent going through this over 7 months and talking about the difficult and hard things that could happen in a different way if we have this disease take off and fill the hospitals and the harms that happen to people, it's very difficult to imagine what that would look like. And because it hasn't happened like that here, it's hard to believe it would happen here, but it's all these measures we've taken that have kept us so far from having it occur. So we are committed to working as hard as we can and finding the best ways to get kids back to school. I think we will hopefully learn from the lessons that these people do in other states where we see them shutting down schools so quickly and having problems, and hopefully we'll learn from their well-intended missteps where I'm sure they weren't trying to harm anyone, they're just trying to get kids back to school. But I think we've shown in Kentucky, if we go with a little bit more deliberation, we can learn from what others do and do better than they have from learning from their missteps along the way. James, or it's not James, if you could show me my slides, great. So we're still trying to do a number of innovative things in Kentucky here to try to help keep people safe in different ways than having the Q-tip in your nose. And so we are working now, we're about to launch a pilot in 2 of our state correctional centers in the Louisville area to do wastewater testing. And so this slide shows the diversity of the partnership. It's a true public-private collaboration. University of Louisville is involved from an academic side, and we have a number of other partners, including AECOM, which is an industrial contractor that works with FEMA, the Emergency Management Agency. And we are going to start a multi-month pilot program to test the wastewater, that's sewage water that comes from the prisons, which has been shown in other promising early studies to be an early indicator for when disease is present, and it enables us to monitor a population that's confined in an area without having to test them unless we see a warning sign in the wastewater. It also shows up multiple days earlier than people become symptomatic in the confined community. So there's a lot of reason to be hopeful about this, and we are committed to keeping our inmates and the staff that work there safe. And so this is an exciting development for us to work on this. If I could have the next slide, please. I said that there would be a chapter 2. It will be an abbreviated chapter 2 for tonight. Public health has to balance always the need to inform the public so the public can have confidence in the information we share and make its own informed decisions about where they place risk, what risks they are willing to take and what risks they are not willing to take. And we need to empower you as much as we're able to. It's one of the reasons we spend all this time and give all this data and do these press conferences so regularly. The governor has been committed to doing that from the beginning, and I hope you found that helpful. On that previous slide, though, we already give data out in certain communities or populations. We do it with the nursing homes. On this one, on that report that we give, it's that little gray bar or box in the top left is on our website every day, and every day it's updated except the weekend. You click on that, it'll show you all the nursing homes in the state, positive cases, both in staff and both in residents. This at the bottom of the report is for our behavioral health facilities that we operate at the state level. And we also give that same information. Those individuals are more vulnerable. They're not able to leave those communities as readily or if at all. And so we release that information so that the people in those settings and also their family members have that information. That is where we have tried to balance the need for the public to know to make a decision against the privacy or respect for the privacy of either an entity or the people living there. On the next slide now, please. So for K through 12 schools, this falls into a similar category. We are working now to build a process where when a new staff member or student is identified positive with COVID-19, that we will have a communication between the schools and the public health community, either local and or state. And then the school will be given the opportunity to notify their own community. And then once a day, every day, like we already do at these press conferences, we will update a publicly reported school report that shows cases. Now I will tell you, like with all of these things, it will be a work in progress because schools already have to report and do, and you all know this if you're a parent. Kids have lice, if kids have strep throat. They do this already. It's already in statute. There's no new statute. It's already existing. But we're having to build a system to try to do this so that the public knows. Because when we do go back to opening up, when people make those decisions, the public needs to be able to know what risk they are or are not taking if their child goes into the classroom. And same thing for the staff, the teachers and the rest of the staff that support the building. And this is an attempt to be transparent, but also to work with the educational community so they have the opportunity first to inform their community and inform what steps are being taken and what they see the implications of that information being. So I look forward to that partnership with the schools, like we do on many other diseases, to try to help keep people safe and keep the public informed. And Governor, thank you very much for the opportunity to share these things, and we'll get through this. And as the Governor says, we'll get through it together, so thank you.